Hi, I'm Dr. Bob Lutz, Spokane County Health Officer. Since the beginning of the COVID-19 pandemic, I've stood here with Caroline Allen, a professional interpreter for American Sign Language, or ASL. We've shared vital information about COVID-19 and ways to keep you, your family and friends, and the community healthy. One of those methods is this: to wear a mask or face covering. Although this simple action can help slow the spread of COVID-19, it can be quite a challenge for those who are deaf or hard of hearing. This is because ASL requires the use of facial expressions in order to interpret the full meaning of our words. Here in our studio, Caroline stands more than 6 feet away from me because she needs to remove her mask in order to effectively communicate. Out in public, it's still important for those who are deaf and hard of hearing to wear a mask. However, they are allowed to remove their masks when they need to communicate with others. Also, if you work in a job where you may need to communicate with someone who is deaf or hard of hearing, you're allowed to briefly remove your mask so that they can read your lips. In both instances, it is recommended to distance yourself at least 6 feet apart if you don't have a plexiglass barrier between you. Some quick tips to help us all communicate better with each other. Consider a smartphone app that helps with speech-to-text or sound amplifying capabilities. Carry a pen and paper or have them on hand at your workspace. Try more gestures, even if you don't use actual ASL signs. Consider a clear face covering that allows others to see your lips when you speak. Most importantly, be kind and use extra patience in communicating. Thank you, and don't forget, wash your hands, stay 6 feet apart, and wear your mask. Have a good day.